I was going to start the questioning here to you in terms of progesterone and its beneficial effects. How do you interpret this negative effect that was shown in the trials in comparison to truly what progesterone is capable of doing?
There have been, I think it was about 15 big studies on brain injury, and interestingly, after overwhelmingly promising results from, for example, using intravenous magnesium to reduce swelling and restore metabolism, all of these, by the time they reached the phase 3 level, suddenly the results were the opposite, and nothing turned out to be beneficial for treating human brain trauma, even though the previous smaller studies and many, many animal studies were showing overwhelming good increased survival, increased full recovery, and so on. And the fact that something happens at the phase 3 level, I think, is very suspicious when the government and big corporations get involved. I suspect that they really are protecting drugs that are not generic the way progesterone is. Urea, I don't think there has ever been a major study of treating brain trauma with simply intravenous urea, but it has had just amazingly good results. And I think probably a serious study could be done using all of the known beneficial things, urea, magnesium, progesterone, hypertonic saline solution, and so on. I think if you do everything that's known to be beneficial to the brain, you would get even better results than with a single drug-like treatment. The worst thing about this big PROTECT study, I think, was that they not only didn't give a big enough dose, but they gave it emulsified with, I think it was intralipid, a soybean oil. Mm-hmm. Yep. And the amount of soybean emulsion that they were giving intravenously in the animal studies, it in itself is harmful.
Yeah, it was a 6% solution.
I think it was about 1970. Someone injected an emulsified soy oil into rats and showed that on the first pass through the brain, 17% of the oil was taken up into the brain. There's no blood-brain barrier that functions against oil. And then they dissected the brain and showed that one dose of oil was enough to alter the morphology of brain cells. Yep. So intravenous treatment with something supposedly beneficial with a known toxin to the brain with a long history of evidence, it's hard to imagine how corporate and government interests putting millions of dollars into the project could have been that ignorant.
Yeah. Okay, and the other thing I noticed from that trial, you mentioned the 6% soybean oil that they used. They were only using 2 milligrams of progesterone per milliliter for the active treatment, and then the drug infusion was started intravenously with a loading dose of 0.71 milligrams per kilo body weight per hour for 1 hour, followed by 0.5 milligrams per kilo per hour for the rest of the 119 hours. So they were getting 2, and I'd like you to put this in perspective for people that are listening, because maybe people don't quite understand the normal values that females are exposed to during the menstrual cycle and or pregnancy. So 2 milligrams of progesterone per mil, so basically 0.5 milligram per kilo per hour for 120 hours. So would you put either half a milligram or 2 milligrams in perspective of the progesterone exposure that most females enjoy?
Some people have reported that in the last week or two of a healthy pregnancy, a woman's placenta is producing 800 or 900 milligrams of progesterone per day.
Right.
And that doesn't do anything potentially harmful. It's very protective. Women generally feel great the last 2 or 3 weeks when their progesterone is at a maximum. So they could easily have given 2,000 milligrams of progesterone per day instead of a few hundred milligrams.
Right. Well, this was 2 milligrams. So, yeah, 2 milligrams per hour. Okay, crazy. So that brings me on to the next thing, and it took a long time to find this because there's a lot of information, repeated information that people are quoting from this same study to say that progesterone is not effective for traumatic brain injury. Hundreds and hundreds and hundreds, and very little actual pro-supportive evidence for progesterone's anti-inflammatory effect and brain edema decreasing effect. But one person in particular, this particular doctor who was studying this at Emory University, and his name is Donald Stein, he published a couple of articles back in 2013 when he was very hopeful that this phase 3 trial was going to show very positive results for progesterone. And I think it took maybe 18 months to 2 years afterwards for him to publish this latest paper in the Journal of Neurotrauma, dated June 1st, 2017, and it's titled Suboptimal Dosing Parameters as Possible Factors in the Negative Phase 3 Clinical Trials of Progesterone for Traumatic Brain Injury. And it's about a 4-page article basically refuting the dose that was given. And as you mentioned, the emulsifying agent, the polyunsaturated fat that was used, the soybean oil that was used as a carrier, certainly bringing its own negative inflammatory effects. And you've always talked about POOF as being pro-estrogenic, and estrogen obviously is a known waterlogger, both of neurons and cells. And so all of this is working against any tiny dose of progesterone that was part of the trial. So just again, for people that are listening, it's very difficult sometimes to wade through all this material and find the facts, because a lot of it is being promoted by pretty vested interests that are plugged into many different levels of academia, with people doing follow-up research to get their PhDs, etc. And we all know from what you've mentioned and from personal experience with people that have been in academia that there is this real egocentric mentality running through the departments, and obviously funding that runs through those same mentalities that people don't want to give up. And so it's very difficult sometimes to find objective truth, but it is out there. And so that's what this show's been around for a long time, is to have you on the show and get you to refute what have been believed innocently, I think, for the longest time, because we've been taught it and we think these people are telling the truth. But your research shows otherwise.
You mentioned the estrogenic effect of the polyunsaturated fats. When there's a trauma, the toxicity of the polyunsaturated fats is tremendously amplified by their conversion to the pro-inflammatory prostaglandins. And in any trauma, not just trauma, but any harmful experience of an organism, estrogen is produced in the injured tissue and in the whole organism. It can be sunburn or parasites in the intestine or broken bone, X-ray treatment, any harm you can think of due to the organism is going to increase the estrogen production and the conversion of polyunsaturated fats to the pro-inflammatory mediators.